Good afternoon, everybody. Thanks for joining us today for our Lunch and Learn. It's good to see some new faces again, but it's also good to see those of you who are returning every month, so this is a good thing. If you ever have any suggestions for our Lunch and Learn, please be sure to share those with us because we like those suggestions as well. So I won't waste your time any further. I know you didn't come here to listen to me talk, so you're here to listen to Dr. Lee from Avera, and she also does call and hospital over at the hospital here too. So I will turn it over to Dr. Lee.
Hi everybody. Welcome to today's Lunch and Learn presentation. It's entitled Healthy Growth in Childhood. I'm Dr. Kelsey Lee. I am a family physician here at Avera Medical Group in Sibley. I do start with a disclaimer that this talk is for educational purposes only. So if you have questions or concerns, talk to your physician and to get an evaluation and treatment. Oh, and I just remembered, people who are on Zoom, I'm supposed to ask that you type in your name and location so that your presence is included. All right, so my background, as I've said, is I'm a family physician, so I provide care for adults and children. For children, we do wellness visits where we monitor growth. This is usually annually for children and teenagers, and then more frequent for toddlers and babies. Between wellness exams, children may find themselves ill, in which case we can also see them for acute visits. I am also a diplomate of the American Board of Obesity Medicine, which is specialized training in obesity care, and I am a First 5 physician peer consultant, which is through the Iowa Department of Health and Human Services. This helps bridge primary care and public health services in Iowa. In that capacity, I provide educational talks like this one. All right. So throughout this discussion, we'll be first touching on what's typical growth in childhood look like, what's atypical and may indicate an intervention. We'll be talking about nourishing foods, how to identify them, and then integrate them in a reasonable manner. We'll talk about some other weight influencers like physical activity, sleep. I've also included some family resources and some recipe ideas. The handout you guys have on your tables is actually a dice. It can be cut out and then taped together to form a dice. So if you have kids or grandkids that maybe like to do some projects, this is a fun one. The idea of it is that you can roll the dice and kind of see what healthy snack you guys can make together in the kitchen. So for our outline here, so like I said, we're going to be doing some family resources. You got recipe ideas on that dice, and then I'll be talking briefly about medical weight management specifically for pediatric obesity, so you know what that looks like. So like I mentioned, we do well child visits. We do measurements of a child's height, weight, and early on we also do their head circumference. We'll ask about physical activity and diet and sleep. And then we tend to plot these on a nice chart to understand how a child is growing. For children under 2, the standardized growth charts that are used usually come from the World Health Organization, and then after 2, we use the CDC charts. A growth chart is also called a growth curve because it'll naturally curve. Babies will grow the fastest in their velocity, and then it tends to level off as we reach adulthood. And then there are specialized growth charts for different populations. So prematurity has a specialized growth chart. Pediatric obesity actually has a specialized growth chart so that you can better understand how a child is growing. These are the growth charts for boys. So on the left there is for less than 2, and then the one in the middle is for over 2, and these have references to like their age versus their height and their weight. You'll see that the curve kind of naturally goes quick pretty early, and then as they reach adulthood, levels off. On this right side is more of a BMI, which remember is a calculation of weight divided by height squared. These are for girls. They color code them blue and pink to make it easy for us. So abnormal versus normal childhood growth. When there's growth that's less than the 5th percentile, this is considered underweight. Normal is between 5th and 85th, and then overweight is 85th through 95th percentile, which is at risk for obesity, and then obesity is 95th or more. Obesity essentially is extra weight compared to the length or the height of a child. Like I mentioned, pediatric obesity has its own growth curves. If you remember those BMI charts on the last one, this is kind of what this lower part is. This is for girls, that one over there is for boys. And then this is a reference to understand where they are in terms of their excess weight. So a child can be underweight for a number of reasons. It could be a growth stunt, or it could be related to a medical condition. Anything that will affect the metabolic needs of the child, or how they're absorbing, or how they keep nutrients in their system can be a reason why their growth is underweight. So there's genetic syndromes that can do this, there's hormonal problems that can do this, and a lot of things. So when a child is showing these signs, they typically undergo a workup from their doctor. It might include some labs or radiography, and the treatment is geared towards treating whatever's causing it, and then and optimizing diet, so it's quite nourishing. Now, just similarly, an overweight child can also be related to a myriad of conditions or issues. Obesity itself is considered a chronic disease resulting in altered anatomy, physiology, and metabolism, which can affect physical and mental health trajectory of children and adolescents. So what we're seeing is we're seeing high blood pressure, high cholesterol, type 2 diabetes, fatty liver. We can see a worsening of existing breathing troubles like asthma, and many other issues. Pediatric obesity affects more than 14 million children in this country, which is a rate of about 19%, or 1 in 5. As a comparison, in the 1960s, this rate was about 5%. It took a swift increase in the 80s and 90s and has just continued to rise. There is some racial discrepancies between this, so about 1 in 4 Hispanic children or non-Hispanic Black children have pediatric obesity, and then the rate is lower in non-Hispanic white children at 16% and 9% at non-Hispanic Asian children. So a doctor who identifies this at their wellness visit may do some additional exam or lab testing to find the cause or a complication of this type of growth. When they look for labs, a lot of times they're looking at liver or blood glucose levels, cholesterol levels, and then recommendations may include lifestyle changes or dietitian referral, feeding therapy, medications, or for some even surgery. So we'll talk more about typical growth and then what practices help aid this in each age group. So we'll start with infants, the cutest of the age group. Just kidding. So a typical baby is usually weighing between 5 pounds, 8 ounces, and 8 pounds and 13 ounces. They typically lose a little weight in that first couple weeks of life, or first week of life, and then they kind of gain it back by 2 weeks or beyond. They grow 30 grams or about an ounce a day for the first month, and that slows to about 20 grams per day. By 6 months, they double their weight, and by 12 months, they triple their weight. So, which is incredible if you think about it over a lifespan. If I tripled my weight that quickly, that would be really something. But for a baby, no big deal. Most of the nourishment at this age is coming from milk. Solids can be started between 4 to 6 months of age, and are recommended to include some kind of iron or zinc enriched substance. So you see a lot of fortified cereal or pureed meats. You want to avoid choking hazards in this age group, and all age groups actually. Healthy amount of fat is part of what babies and early toddlers need so that they can get adequate myelination or brain growth. Babies are not born with a fully developed brain when they're born. It actually continues to develop and grow as they age. So you want to support that with adequate nutrition. In terms of atypical growth, sometimes we can see rapid weight gain between 6 to 12 months. What we sometimes see is with formula-fed infants, they tend to have higher protein and energy intake, and this can lead to differences in pancreatic and gut hormones, which ultimately lead to more fat deposition or higher weight. So where it is, economically and emotionally and physically feasible to do so, we recommend breastfeeding exclusively. You do want to avoid any fruit juice in infants, and then you can actually start the process prenatally of supporting a healthy weight by avoiding highly processed foods and just keeping an eye on that weight gain during pregnancy. So now we'll move on to toddlers. So toddlers are in a great state of learning. They're learning to move and play and speak and behave or not behave. Their appetite and growth waxes and wanes quite a bit at this age, so you'll see a lot of day-to-day variance. So one day they eat a normal amount a toddler would eat, the next day they could barely eat anything, and then the third day they eat more than they normally would. Now they're eating for their growth and their physical activity, so this day-to-day variance makes sense. But those days when they're not eating as much as they normally would can bring frustration or anxiety to parents. So it's important to try to avoid the finish your plate mentality. This teaches them at a pretty early age to ignore their own satiety signals, which are kind of naturally and appropriately variable each day. A good rule of thumb is to just parents provide the food and the children decide how much they're going to eat of that meal. You'll want to provide healthy selection of foods, so stuff rich in calcium and fiber, so fruits, vegetables, whole grains, and beans. It's important to demonstrate your own liking for this food by eating it too. And then picky eating, keep in mind, is very normal. It takes 7 to 11 exposures to a new food to really gain a palate for it. And with toddlers, they can have a food they like 11 times, and then the 12th time they don't like it anymore. So just roll with the resistance and keep the experience positive and pressure low so you can avoid the food battles. Neurodivergent children, so a child that has autism, for example, may have some extreme aversions to particular foods or flavors. They have done feeding therapy, which is helpful for them to still gain palate for wider amounts of food. So as toddlers are transitioning away from infanthood, they should also transition away from milk-only diets. So milk provides a lot of protein, calcium, vitamin D, and fat, but they don't have everything a toddler needs. So when you hit toddlerhood, then you may have to look at how much milk they're getting to slow it down some. So between 1 and 2, you don't want more than 24 ounces of whole milk. Between 2 to 3, no more than 16 ounces, and at that age, you're switching to skim or 1% milk. The benefit of kind of limiting some of this is that they will be more hungry at mealtime, so more apt to eat fruits and vegetables. And then it can help prevent iron deficiency anemia, which is sometimes associated with those milk-heavy diets in toddlers. And then it improves constipation as well. All right, we'll move on to grade school children, so those between 6 and 12 years of age. On average, during this time frame, a child is growing about 2 inches, maybe 2.5 in height, gaining about 5 pounds or 4 to 7 pounds until puberty hits. They are still needing some fat. Myelination typically ends around 7, and then their bones still need some calcium. Actually, their highest needs are between 9 and 18 years of age. That's when their most bone mass is being built. Socially speaking, children are able to make a few more decisions for themselves, and they may be looking into things like vegetarian type meals. If your children or grandchildren decide to explore that option, just be sure to have enough plant-based proteins and calcium options for them. Advocate for healthy food choices in the cafeteria, that kind of thing. Overall, you're really looking for carbs, fats, sodium to all be consumed in moderation rather than in excess. Keep in mind too that this is the age that kids can start having some feelings about how they're growing or how they look, and it's important to help them to understand it's not about how you look, it's about fueling your body with good nourishment and keeping your body active and strong. So calcium, like I mentioned, this is a big thing between 9 and 18 years of age. I think most people realize that there's calcium in dairy products, but there's also calcium in protein, in some produce, grains. Collard greens especially has a lot of calcium in it. Some drinks or foods may be fortified with calcium, so you can keep an eye on those as well. There's technically not a minimum amount of milk that they need, but they do need a minimum amount of calcium, and you'll see those demonstrated on the left there. Essentially, 9 to 18, you're looking at about 4 servings daily of a calcium-rich substance. They have seen higher risk of bone fractures in children with higher soda pop intake. They don't think it's as much about the soda pop as the soda pop is maybe taking the place of some calcium-rich drinks like milk. And then not getting enough calcium leads to lower bone mass. So. We will move on to preteens and teenagers. All right, adolescence is a whirlwind of physical, emotional, and social change from a physical standpoint. Teenagers are going through puberty, so they are experiencing more rapid growth than they were seeing previously. Girls are typically between 11 and 16, boys are between 12 and 18. They will need more calories to accommodate this growth, particularly protein and calcium, healthy fats, and carbs in moderation. You'll want to try to avoid getting those extra calories from fast food or other foods that are pretty low in nourishment. Girls may need additional iron during menstruation, especially if it's on the heavier flow side. And then boys often start to need more calories and protein at this age. In general, we recommend no caffeine less than 12 and really to avoid it in 12 to 17, although there were some studies that said you could do up to 100 milligrams. Oftentimes, high caffeine drinks like your energy drinks are pretty high in sugar and not very nourishing when it comes to nutrients. This is a chart that kind of just demonstrates how those calorie needs change throughout their life. So you can see between boys and girls, they start pretty similarly. They increase as they age because their bodies are bigger. And then as preteen and teenage hits, then the boys start to pull away and need more calories. If a child is eating more than 1,000 calories than what they need, so excess of 1,000 calories, they can gain an excess of 57 pounds in 10 years, which is a lot of excess weight gain. Now, just because there's long-term overconsumption risks, that doesn't mean you should over restrict how many calories that they need to. Children are growing very important organs at this stage, and they do need calories. And then remember too, if your child or grandchild is more of a high-performing athlete, they may need even more calories than what is listed here. All right. So they are also undergoing changes in their emotional and cognitive states. So you'll see more from pre-logical kind of black and white thinking to more abstract thinking, more critical thinking, and then more importance with peer relationships and social acceptance. This newfound sense of self can sometimes be associated with anxieties about body image. So remember that to some degree this is normal in adolescent development, so you want to be supportive, have open communication, and positive role modeling. If you're seeing that these anxieties are really escalating, maybe it's hard for them to kind of shut those anxieties off, and then you're seeing like maybe changes in eating patterns or unusual weight fluctuations, then you do want to consult your physician about that. Unfortunately, eating disorders is quite common in general, but particularly in this age group between 14 and 17. So if you're seeing those things, definitely make sure your doctor knows about them. All right, so that's the background information. So we're going to move on to a nutrition pop quiz. Did you guys study? Is this a healthy food? What do you think? Yes. Okay, apples are fruit. Those are good, right? But they have sugar. Isn't that bad? Yep. Yeah. Oh. So, but they have fiber. That's good. So they're good. They're probably good. Okay. How about this one? Potato. Yeah. Potato's a vegetable. Yeah. It's got potassium. Good. And vitamin A. That's good. But they have them in French fries. Aren't French fries bad? I don't know. What about this one? This one's got to be bad, right? It's pizza. It's supposed to be bad for you. It's full of carbs and fats and processed meats. Does pizza have to be unhealthy? Can you eat pizza if you want to eat healthy? I would recommend moving away from the dichotomy of good or bad foods. I recommend recognizing nourishment in foods because that will help guide you with what nourishment and how much of it is what you really need. So what does this mean? So you're looking at a food and deciding, is this nutritious for me? Is there nutrients in this? Is there vitamins, minerals, micronutrients, fiber, protein, unsaturated fats? The things that are high in these also tend to be low in calories. So they're your lean meats, your fish, your whole grains, fruits, vegetables. They tend to be whole foods that are minimally processed. Nutrient-sparse foods tend to be high volumes of added sugar, sodium, starches. Oftentimes they're processed foods. We hear a lot about processed foods, and you may be wondering, what's so bad about them? Why do we always criticize them? I think to answer this question, you have to kind of look at a more basic question, which is, what is a processed food? Any food that goes from its normal state to an added substance is a processed food. You've processed it in some way. Depending on what the process is, you can keep a lot of the nutrients in it, or you can destroy a lot of the nutrients in it. So this is a very busy slide, but I'll walk you through it, okay? So minimally processed foods are foods that you just have to kind of do a couple things to, and then they're in a basic ready-to-eat state. So for a potato, it might be removing the little tubers that grow on the side, or roasting, or freezing, or pasteurization. So taking something and just making it safe and edible. Processed ingredients are usually things that you add to minimally processed foods, so stuff like maple syrup or honey, where you're probably not eating a bunch of maple syrup for your whole meal, but you're adding it to a unprocessed food or minimally processed to make some type of very basic processed food. So cheese, canned vegetables, salted nuts, fresh bread. This should be contrasted from ultra-processed foods. So these are foods that have been manipulated with some kind of industrial processing. A lot of times it means adding sugars that didn't exist in the original food. It might mean adding hydrogenated fats or hydrolyzed protein. It might mean adding some kind of additive to make the color more robust, to make it look more appetizing. It might be some kind of emulsifier or gelling agent. These ingredients are very common in foods like cereal, frozen pizza, hot dogs, packaged cookies, fast food. So it would be an example of this. So take that potato. So this is a minimally processed potato that you wash clean, you've got the tuber things off. And then the processed ingredients you use, maybe you did some olive oil, you cut it up, you put some salt and pepper on it, and then you baked it, and you got your roasted potato. That's a basic processed food. Now contrast that to an ultra-processed food. So you took a potato, you cut it. So this is the pathway that one process takes here. Okay, so essentially one popular restaurant, what they do is they cut it up, they rinse it, they dry it, they blanch it, they flash fry it, they freeze it, they mail it to the popular restaurant, they fry it, and then they fry it the second time, and then they cover it in salt. There ends up being 10 ingredients in this French fry, and then it's sold to you very commonly at this restaurant. And you think, okay, so it's still a potato, right? It should still have some good stuff in it. So if you actually look at the nutrition facts from all that extra processing, you've put 10 times the amount of fat, from less than a gram to 11 grams of fat. You've put 3 times the amount of carbs into it, from 13 grams to 31 grams. Fat has, for every gram, has about 9 calories to it. So when you added all of that, and when you add those carbohydrates, you've made that way more energy dense. So it's got way more energy in it. But at the same time, you've lost any real amounts of vitamin A and C, and even these calcium, iron, and potassium, the volumes of it went down. So you've taken a food that would normally have some of this stuff, and you've stripped it of the nutrients because of the processing technique. So your body is impacted by these differences in ultra-processed foods. So when your body eats really anything, there's a lot of neurotransmitters, neuropeptides, and hormones that are triggered that send different signaling in different parts of your brain. Of one that's of importance is dopamine, and that's kind of the reward pathway. It also, and then also stimulating insulin is probably another big one when it comes to food drivers. So different foods can trigger different responses, and with repeated triggers, you can get a downregulation of the effect. So what that means is that you need larger portions in order to have that same satisfaction. You see higher amounts of insulin stimulation, so you're getting more propensity for fat deposition, and this is particularly high in those with existing insulin resistance. So someone with extra weight, maybe prediabetes or something, eats the exact same food in the exact same volume, has a greater fat deposition propensity than someone who is lean eating the exact same meal. Part of the issue with ultra-processed foods is it's very easily absorbed by our body. Your body, when you eat, has to burn some calories in order to actually break down the food so that you can get the nutrients from it. With ultra-processed foods, that part's basically already done, and it can absorb all the calories from it, and hardly any nutrients come with it. with kids, these ultra-processed foods, they curb the hunger, and they're not going to have much of an appetite for the other nourishing parts of their meal. And then because of its effect on the dopaminergic pathways, we've actually seen kind of similar addictive processes when we study the brain and what gets activated after eating certain types of foods. So one interesting, really cool study that they did in 2019 was following a group of 20 people, and they gave 20 people the option to just kind of eat whatever they wanted from a buffet with processed food, and then eat what they wanted from a buffet of unprocessed food. And their only rule was basically, once you're full, like, stop eating, and we're going to govern and kind of figure out who eats what. So it's ad libitum. So ad lib, what do they eat? The people who ate ultra-processed food ate 500 calories more. And mind you, each group did this, and then they had a washout period, and then they switched groups. And every person did the same thing. They ate about 500 more calories on the ultra-processed to feel the same kind of fullness. So it truly does, it's just not a filling type of food. You need higher portions, but those higher portions ends up being way less nourishing for you. So are all processed foods bad? No, actually there's some foods that are fortified with nutrients that help prevent deficiencies. So a good rule of thumb is that the shorter the ingredient list, the better. Particular vitamin D fortified milk in kids is helpful to prevent rickets. Iodized salt is helpful to prevent goiter. But those are very short ingredient lists. So there are some things that I would argue you can learn from processed foods. Processed foods of anything, they're a mastery at presentation and color and appealing to people. And you can use those same principles in your own kitchen to help promote kids eating a little more nourishing foods. So techniques to accomplish this is family meals. So prioritizing those meals where you're eating together at a sit-down time, and then involving the family in meal planning. So they're helping to collaborate with what's going to be an entree or what's going to be a side. With older children, you can even make them in charge of a meal for cooking. For younger children, maybe they come to the grocery store with you and pick the vegetable of the week, so they've got a little more buy-in on what's happening. For those of you with gardens, having them help garden and be engaged in that at an earlier process is helpful. In general, cooking is a great opportunity to do a lot of teaching, math, new vocabulary words, science, even simple like planning a project, reading directions and following through. I mean, those are all incredible things to learn at a young age and to continue. You do want to make sure that safety is recognized, particularly around heat and sharp objects. So I think an issue that sometimes people run into, especially parents, is that kids have a little bit of a narrow palate sometimes. So keep in mind that to kind of get over the anxiety of an unfamiliar food, it takes a few exposures, and those exposures need to be kind of a joyful experience to want to keep eating the unfamiliar so that it becomes the familiar. So it may not be immediately eating either. It may be tearing the lettuce or washing the vegetables or helping to knead dough or taste or smell while you're cooking, so that you can get a little more buy-in once it comes for actual meal time. Like I said, it takes a lot of exposure, so if they don't like a certain kind of food, you can prepare it a different way and reintroduce it in a week or two. Try to do small amounts so you don't have a lot of food wasting when you're kind of experimenting with new foods with them. You can combine unfamiliar flavors with familiar foods. I think yesterday I put ketchup on my son's vegetables so that he would pair his unfamiliar food with familiar food, and it worked out great. So, and I don't need to do that every time, but sometimes it works. There's a technique in feeding therapy called crossing a food bridge. So you take a food that's accepted, like maybe a pumpkin pie, and then you introduce another food that has a similar color, flavor, texture, maybe mashed sweet potatoes, and kind of try that a while until that's accepted, and then maybe you go the next step for mashed carrots. And so you kind of work your way gradually. Another technique that helps sustain healthy nourishment is mindful eating. So eating slow, focusing on your food, appreciating where your food comes from and how we prepare it and who prepared it for you. And then really avoid watching those screens while eating so that you are listening to your body when it's full. All right, another pop quiz. I give a lot of hard questions, so. All right, how many ways are there to prepare cauliflower? What do you think?
Throw it away.
Throw it away. If you guess more than 10, you're correct. There are 11 ways to prepare a cauliflower. Yep. And a lot of it is, it's some loaded cauliflower is a lot like a loaded potato. Maybe you're using cauliflower rice similar to a fried rice, or you can mash it up and use it as pizza crust. There's a lot of ways. I mean, there's 11. We're not going to go through all of them, but there's a lot of ways. And cauliflower is not the only vegetable you can use creatively. And then keep in mind, if your family's food yesterday wasn't the best, amazing, nourishing food ever, or drink, at every turn, that's okay. Just look forward, not behind. How can you make the next meal nourishing? Be patient with yourself and your children during this process, and don't chase perfection, it's just food. Other things that are not nutrition related, that are healthy body weight influencers, is physical activity. That's a big one. For kids, we usually recommend an hour a day, and to avoid sedentary time, so the sitting time. Sometimes screen time can play a role in this. So getting rid of the screens and getting them up and moving is a way to help keep a healthy weight. So this can range, right? It can be organized sports, it can be swimming for fun, it might be family bike rides or dance parties or even stretch breaks. These are all great ways to keep the body moving. Adequate sleep is also important for maintaining weight. And then mental health and adequate stress management is also important. So be a support for your child or grandchild. And then keep in mind too that sometimes when kids are maybe have extra weight or not enough weight, they can sometimes experience weight bias. So be supportive of them and kind of help them. And keep your own bias if you have one in check too, so that they're getting the best support from their family they can. And then lastly, advocate for healthy options and safe physical outlets for physical activity. If there's fundraisers, try to donate to them so that we can keep good physical activity options open to the community for kids. I did want to include a little bit about what does pediatric weight management look like. It is classically approached from a 4-stage model system. Some of it happens in the primary care office, and some of it happens at a more tertiary center. So stage 1 is more about prevention, and so we talk about the 5-2-1 rule. We talk about family meals. Stage 2 is a bit more structured, and you're starting to bring in other specialists to aid with this. So it might be behavior counselor, dietitian. Stage 3 has more frequent visits with a planned energy deficit and more family involvement. And typically stage 4 is when they talk about medication or meal replacement or even surgery for some patients. All right, so this next slide is family resources, and I did want to mention First 5. So First 5, like I had talked about before, it's a program that bridges healthcare services with options to help families in the area. There is a way to refer, and we can post that maybe separately for what the appropriate referral system is. But basically they work with a primary care provider, and so if a child is maybe experiencing some food insecurity, or they're looking for ways to learn more about nutrition, but they're not sure how to access that, they can talk to their primary care doctor, and then First 5 referrals can be made in order to connect children to that, or families to that. Other family resources that I have listed here, Chop Chop Magazine is a magazine subscription from the American Academy of Pediatrics, and they have a lot of recipes and kind of fun ideas. It's a very colorful magazine. The AAP, or the American Academy of Pediatrics, also has their own website, healthykids.org, so there's like games and stuff on there too if your kids or grandkids are into that. ChooseMyPlate.gov is like the similar version to that, but made by the government. There's actually some really good food ideas for people on SNAP benefits. So if you've got a fixed or limited income, sometimes those are helpful to take a look at. There's a host of different books out there that help encourage and really introduce kids to different types of fruits and vegetables. And then to basically make the unfamiliar food more familiar, because you saw it in your book yesterday. There's a really great family nutritionist who has a lot of online content. She considers herself a picky eating expert, but has a lot of good recipes and good just fundamental knowledge of helping to encourage kids to have broader palates. You'll see a few other options listed there. There is a Lifestyle for Teens podcast made by a pediatric endocrinologist who focuses on obesity in teenagers. And there's also, if you are a Twitter user, if you tweet, There is someone you can follow called Dr. Yum, and she's a pediatrician with a lot of good recipe ideas and good techniques for families to maintain healthy weight. So in summary, we talked about healthy growth in childhood. We talked about different nourishing foods and how to engage the family in preparation. We talked about some other weight influencers and then briefly discussed the medical weight management for pediatric obesity. So, thank you all for coming today. What questions can I answer? Yes?
What's your opinion of fruits and vegetables and taking capsules?
Oh, sure.
Nature Made does.
Yeah, sure. So the question was, what is the thought on having fruits and vegetables in a capsule form? Generally, the best absorption happens from the actual fruit and vegetable itself. That's where you get the maximal nutrition from it. So if you can get that, that would probably be the first, the most requested one is like kind of fresh fruit and vegetables. Second being like freezer, like just frozen. As they kind of strip away some of the, kind of the original product, then we lose some of that natural nutrients that we're looking for. But great question. Any other questions? Yeah.
When microwaving food, what are your thoughts about what it does to the nutritional value of the food?
Sure.
Is it good or bad?
Sure, yeah. So any kind of processing, like including microwaving, actually including ovens, they will reduce some of the nutrition in a lot of different foods. I wouldn't say it's so reduced that there's no good to it. Like you can feel free to reheat, like, carrots that you didn't quite finish the day before. But know that each time that you're heating it, it may degrade a little bit of the nutrients in it. So fresh is always best if you can. Yep, good, great question. What other questions? Yeah.
Hi. You have a weight management program for your patients. Could you tell us more about that?
Yeah, so I do weight management. Like I said, it's one of my favorite things to talk about. So if you or you know someone who is has been thinking, gosh, I really want to know more about how to lose weight or what kind of tools there are out there to lose weight, you can see me in the clinic at Avera in Sibley. So I'm happy to assist with that. Yes?
Something you didn't talk about was hydration with kids.
Yeah. Yeah.
So is there recommendations on how much, what's best?
Sure.
for age groups?
Yes. So the question was, what is the recommendation for hydration? So there is not technically a minimum number for ounces of fluid for pediatrics. What AAP would recommend is that you're drinking pretty consistently during the daytime and that you're eating or drinking water typically with meals, and then if you're ever thirsty, drinking more water essentially. Most of the beverage for a child should pretty much be water. I mean, apart from maybe some milk for the calcium source. The energy drinks are really not recommended, like Gatorade or some of those like Powerade things. Usually we say like maybe one, but for the most part you want most of that hydration to come from water. So yep. Yeah, so there's not like a hard minimum on that.
What about the electrolytes?
Sure, yeah, so the benefit of the electrolytes is primarily in like your athlete who's doing a lot of exercising and maybe is burning off a little bit more than they normally would. So in those moments, that's probably the time where it's helpful. But on like a day-to-day, they don't necessarily need the added electrolytes from the drink. Remember, it's coming with extra sugar, and so if you don't need it, get water, the hydration from the water, and then get your nutrition from the food. Yeah, great question. Yeah.
What are your calorie charts for old people?
Sure. Depends on, I have to repeat the question. The question was for older patients, what are the calorie recommendations? So it depends on what your weight goals are. So for people who are trying to lose weight, it depends if they're premenopausal or postmenopausal, but so postmenopausal, maybe an older patient who is hoping to lose some weight, between 1,200 to 1,500 calories per day and sometimes a little closer to that 1,200 calorie day mark. So the sometimes the easiest way to do it is a 500 to 750 calorie deficit from what you were doing previously. So doing like a food journal, figure out where you're running, and then kind of subtract from that gives you a good idea. It's usually roughly about 1,200 for women, closer to maybe 1,500 to 1,800 for men.
So why do you lose more weight when you first start a diet?
Yeah.
The first week, it seems like you lose 3-4 pounds, but that's way more calories than what you could actually lose. So what are you losing?
Sure. So the question was kind of why do we lose more weight earlier in diet plans than we do as we move forward or as we are on it for longer. So depending on the diet, some of it might be water weight. You see that a little bit more with kind of those higher fat, low carb diets than you do with the opposite kind of diet. The other thing too is your body does adapt. Like it figures out what kind of calories it's taking in, and then it's going to adjust other processes to make up for that. So there's something called metabolic adaptation, and it's part of the reason why you can do all the right things and you can lose some weight, but eventually your weight seems to plateau. It's part of that process. It's called metabolic adaptation, that your body just doesn't want to lose more.
So a 200-pound person would lose more calories than a 100-pound person on the same amount of calories?
So it
You're doing the
depends.
Same things.
Yeah.
Same food, same exercise.
Yeah, it
You
depends.
lose more weight when you're heavy than if you're,
Say that last part again. I didn't quite hear that.
okay, so, well, like a 200-pound person, are you using up more calories?
Yep. So if you're a 200, so the question was if you're a 200-pound person versus a 120-pound person, and you're eating the same things, kind of what's the weight trajectory from that? So it actually depends. So someone who is 200 pounds and has been 200 pounds for a long time, and they're sustaining their weight on that diet plan will probably continue unless they reach some kind of a calorie deficit from what they were doing before, in which case they can see some weight loss. If you compare that to someone who's 120 pounds, the actual pound loss may be less with the person who's 120 pounds. Although the body percentage of loss may be higher with the person who's a higher weight, okay? It's complicated, but hopefully that wasn't too convoluted. Yes?
What about the low carb, keto type diets?
Yeah.
Is it a good way to lose weight?
Sure. So the question was, is low carb diets or keto diets a good way to lose weight? For some patients it is. I think for any diet, you really need to think about that long-term sustainability side of things. And if you already tend to eat kind of on the higher fat, lower carbs, and it's a pretty natural way to eat, it may be a pretty adaptive way for you to like keep the weight down and maintain it lower long-term. For a lot of my patients, they like carbohydrates, and having higher fat densities isn't necessarily appealing to them. So for them, I wouldn't necessarily recommend a keto diet. There are a few like medical complications that are, maybe contraindications or kind of special interests for keto. So type 1 diabetics particularly, you want to be very closely guided if you're considering something like a keto diet, or insulin-dependent type 2 diabetes. So there's a little more nuance from the medical side of thing with the keto diet, but overall it's what can you sustain long-term, what do you genuinely like and plan to continue. So.
All those weight loss programs you see on TV, like Golo and all that, are
sure.
actually good for you or not?
Oh, sure. So the question was, the weight loss programs on TV, such as Golo, are they good for you? So depends, right? All the answers always it depends. So Golo specifically has their own kind of study that they did within, like that they paid for, that shows weight loss with their program. I haven't seen one that's from an outside institution show those same results, and with any kind of diet plan, you always want someone who's not invested in the results of it to kind of be studying it. So I think that's a little yet to be seen. Some of the ingredients and some of the like supplements have some basis in weight loss. Like I think one of them is like magnesium, and I think another one's like caffeine maybe. There's a few ingredients where if you look at more generalized studies, there's been studies out there that have correlated some weight loss. But whether or not those are really ready for prime time is I think debatable. Most of the time when it comes to diet plans, sustainable things, you're looking at how can I maximize your whole foods, your unprocessed foods, get enough hydration, get enough nourishment, and then protein as you're losing weight. Yeah. What else can I answer? Yeah.
What
What's your opinion on intermittent fasting?
Yeah. So the question was, what is my opinion on intermittent fasting? Similar to keto diet, intermittent fasting can be an effective and safe way to lose weight. For certain patients, I would be very cautious or maybe contraindicated to lose weight in that manner. Patients particularly that have more of like a binge eating pattern with their extra calories in may find themselves overeating at times when they're trying to eat, and as opposed to like those non-fasting times. Whereas if they just ate kind of that routine 3 meals a day, they would be taking in less calories and feeling more satiated and full that way. So it depends on the person, but definitely there's studies showing that it's helpful and beneficial. What else? Yeah. Sorry. Oh, it's okay.
So we have 4 grown granddaughters, and then we have another start over, so we got 7, 5, and an infant. So the older granddaughters, they're adults kind of doing their own thing, but we see them every weekend. And they drink some kind of energy drink or some frou-frou thing. I can't even imagine being able to afford it. They don't drink water.
Sure.
And are those addictive? Because it's like they really, Mom,
They
do
gotta
you have
have
any whatever it was? And she's like, well, no, I don't have any. And it's like, well, I gotta go buy some. And I just wonder if it's that addictive.
Sure. So the question was on a certain type of like a beverage, maybe like an energy drink is maybe what I'm gathering, like a sweetened energy drink. Can they be addictive? Yeah, I would say yes. They've got, they mimic addictive processes with the activation of the dopaminergic pathways in studies. So the caffeine intake can sometimes be an issue, especially excessive caffeine. So there's ER visits for people who have caffeine intoxication, like they get too much. So that's where between 12 and 17, we usually just say avoid it altogether. But if you just can't get away from it, maybe 100 milligram limit. So that might be that's usually way less than what's in the energy drinks though. So those could sometimes be 200 or 300 or sometimes more milligrams in a beverage. So, and then too, they're not, it's not water. We want water to hydrate you. That's going to be the thing that's best for your cells and keep you good and strong and healthy. So.
But what if you get tired of just plain water?
Yeah. So the question was, water can be boring. What can we add to it? So one of the ways is kind of altering the temperature, right? Sometimes people love ice cold water. Sometimes we like more lukewarm. And then you can add stuff too, like teas, especially herbal teas is a great way to add a little flavor. I love adding lemon or watermelon to water, and you can keep it in the fridge in a pitcher that way and have just a fruit kind of infusing in there. Cucumber water is another good one. So, keeping up, changing the profile of that is fine. Yeah, and very safe and everything.
Have you ever used any diabetic drugs in your practice to help people with their weight loss?
Sure. So the question was, do I ever use diabetic medications to help lose weight? So the medications that I'll use, some of them have indications for diabetes and some have an indication for extra weight or weight management, and some of them do both. And so for patients where it's indicated, yeah, I've used medications that treat diabetes but also treat their extra weight. Yeah, good question. Yeah. What else?
I know of some people that are using that Ozempic
Sure.
for losing weight, and now they're claiming that it's their organs are failing from using that.
Oh, okay.
Is Ozempic actually used for losing weight?
Sure. So the question was, is Ozempic used for losing weight, and then potentially too, does it cause multi-organ kind of failure? I would say that would not be the common reaction to that medicine. It's always hard when you've got a specific instance because you almost want to see their chart and be like, okay, what was going on? What are the nuances of that? The most common, and then your other question of okay, Ozempic, is it being used for weight loss for some patients? Practically, yes, it is being used that way in the world. And it's a very similar medication with a different brand name when it's marketed for weight loss. So that's, I think, why people are using it that way. And then the most common side effects you'll see is like nausea or throwing up or diarrhea. It's like any side effect from a medicine. Some people have no side effects and other people have all the side effects. So potentially that person maybe like got too dehydrated from like too many side effects or something like that.
Well, on TV, they have lawyers now that are
Oh,
saying,
sure.
if you've taken Ozempic,
Sure, yeah. Then you might be entitled to some.
yeah.
Sure, yeah. So I think if you're gonna start any medicine for any condition, obesity, diabetes, high blood pressure, anything, you should closely follow with your doctor. So if you're seeing signs of like, disease or other problems, then you should probably get off the medicine or switch it or something, yeah. Yeah, the whole idea of treating this is not to make your life worse. So if your life is getting worse from treating it, then that would be a good sign that that treatment's not right for you, Yeah. All right, what else? Yeah?
What's your opinion of grazing?
Oh, sure. The question was, what's my opinion of grazing? So again, it always depends on what your weight goals are. For people who are trying to lose weight, grazing can sometimes be a drawback. If you're kind of eating frequently, you may have more insulin stimulation, and when the insulin's up a little higher, you can get a bit of a resistance to it. And so the propensity for extra weight from the calories may be higher. Now, if you're somebody who's trying to gain weight, like that's an okay thing, that's helping to accommodate that. If you're trying to lose weight, sometimes grazing can work against that. But again, it's very dependent on the person themselves and their habits and their weight goals. So not everyone's looking to lose weight, just some people are. What else? Yeah.
Do you have, like addressing the older crowd?
Yeah.
Do you have a similar talk geared to that?
I don't yet, but it sounds like that may be something that people would want to see. Yeah. Okay. Well, I'll work on it.
I learned a lot.
Yeah, good, awesome.
And all that too, but,
I'm glad.
I tried to talk to my husband into coming, and we had a plumber coming. Oh, no.
Oh, sure. Yeah.
It's just, when you get a certain age and then your body switches gears on you.
Mm-hmm. Yep.
And you think you're doing the right thing and then you find out, it's not so good.
Yeah, sure.
Instead of spending hours and hours researching yourself, which is
Yes.
kind of what I do. And then you don't learn the right thing anyway.
Mm-hmm.
I would like a geared.
Yeah, I think that would be a great idea. So the question or the recommendation was to have one geared towards adults and especially older adults too, as the basal metabolic rate is slowing down. How do we kind of accommodate that with our dietary changes? Because you're right, you can eat the exact same way and gain weight from it, even though you haven't really changed your nutrition, but your body's changed. So yeah,
I walked out past the bakery
sure.
and gained 5 pounds.
Well, the bakery here in town is so good. It's hard not to.
I just got chocolate chips from there.
Yes.
How does your sleep or lack of sleep affect your weight?
Yeah. So the question was how does sleep and adequate sleep impact weight? So when people are sleep deprived, we find that they have higher amounts of cortisol level or compared to when someone's getting normal amounts of sleep. And cortisol has a kind of a weight gaining propensity. So there's a lot of mechanisms, some we understand, some we don't, but that's one in particular where there's a higher weight association with that. Yeah. Yeah, so getting adequate sleep is very helpful for maintaining and just feeling good too. It's a lot easier to make the right decision when you don't feel run down, So I think that's important too. So the question was, what do you do for sleep? Depends. I always say depends, right? But it depends on what's preventing the sleep. If you've got a dog that sleeps in your bed and rolls over and wakes you up 3 times a night, probably have the dog sleep outside. If you've got maybe some underlying like mood or anxiety symptoms, or it's just hard to shut that brain off at nighttime, maybe look into that. Do you need therapy or medications or something? So it needs to be dependent or geared towards what's causing the sleep problem for sure. Good question. Mm-hmm. What else? Yeah.
So, how do you, I'm trying to find the politically correct way to say this. So your granddaughters are just choking down all this
Sure.
stuff. You know, in addition to, that coffee place, you get these big, huge flavored coffee things.
Oh, yeah.
How do you as a grandparent
Sure.
kind of interject yourself into the conversation? Because
Sure.
here's all four of them right in front of you, and we're all having dinner together, and, you know, they're just,
Yeah, sure.
I don't know how to bring that up without insulting.
Sure,
daughter,
absolutely.
You know?
Yep. So the question was, as a grandparent, when you're seeing your grandkids maybe engaging in some drinks that aren't very nourishing, how do you like encourage that more nourishing drink? I think having conversations, you know, and demonstrating, and when they're with you, you know, having those options available. If you get the feedback that, well, we just don't like water, you know, okay, well, maybe we'll try watermelon in the water, and then next time they come, then we'll try a little watermelon water, a little cucumber water. And, you know, I think there's a role for some things too where, okay, if it's Kool-Aid is better than an energy drink, and if you kind of need a midway step to make it a little better and more palatable to kind of slowly, gradually get towards something a little more nourishing, maybe that's the step you take, you know? I think it needs to be catered to them and kind of what feedback you're getting from them. Is it a taste thing? Is it sometimes when you have that caffeine and you haven't had it, then sometimes you can get some headaches? Is it that they're kind of physically used to it and they just don't want to feel badly? So I would say kind of gearing it towards that would be helpful, and then kind of meeting the resistance and keeping it positive, you know. So, yeah.
You think kind of, some of it is kind of society, everybody's drinking this stuff, so
Yes.
they want to do it to fit
Yep.
in.
And the comment was part of this is society and our culture of kind of drinking these things, and yeah, oh man, the advertising for foods, what they'll spend. I mean, they're experts at it. They've got food experts to make it taste as good as possible. They have, you know, advertising people who make it seem as great as possible. So, yeah, and kids are especially, you know, apt for that. So there has been more legislation kind of limiting what and how much can be advertised to kids. But I think from a larger standpoint, like that's the kind of stuff we need to be voting for and thinking about as adults, you know. Yeah, here, I think you had your hand raised first, so yeah.
How do you feel about that carbonated water? I was addicted to soda.
Sure,
I had to quit, but I craved the carbonation.
sure, yeah.
So they have carbonated water.
Sure, yeah.
Is that okay still?
So the question was, can you drink carbonated water in place of soda pop and still see some benefits from that? I would say you can, yep. There's different artificial sugars that sometimes are used to sweeten it, and sometimes they don't have anything extra. Sometimes it's literally just carbonated water. For the stuff where it's got the artificial sugars, usually we kind of approach it with a little bit is probably okay, but you don't want to go in excess. And then, you know, just straight carbonated water I think is a much better option compared to soda pop. So good job, keep it up. And then there was a question in the back.
What do you think of vitamin water?
Oh, vitamin water, yeah. So I think it always depends, right? Because it's like, what else comes with the vitamin water? You know, is it just straight vitamins, or is there, you know, a bunch of sweeteners in it, or extra calories or things that you don't need? It's, as a rule of thumb, like eating your nutrition is always going to be the best way to absorb it, and so that's the way you prefer to do it. But I mean, there's times when you're just not hungry for that. I mean, it's not a terrible thing to do. I think it's more how often, everything in moderation and stuff like that, where it tends to be a little more loaded in sugar, then you'd really want to be cautious with it. No. What else? Yeah.
I'm a Diet Coke addict, and everybody tells me that that's what causes my problem.
Sure. Yeah.
Is it really?
So the question was, what's the role of like excess Diet Coke on weight? So yeah. So Diet Coke, how do they get it to taste sweet if it doesn't have sugar? So they use an artificial.
Diet Coke does not taste as sweet as regular Coke.
Yes, yeah, you're correct. Yep. So, but they use an artificial sweetener, so it's still like kind of it tickles that funny bone, it tickles that sweetness bone. But they can do it with smaller amounts typically, because the substances they use are usually more sweet when you look at it per gram, right? And then they don't have to use sugar and add those extra calories in, and then you end up with a diet soda. So a lot of those can still impact insulin release, and insulin release is where you see like, okay, your sugars aren't, and then so you get a resistance when it's, you know, frequently being released because your body is kind of down regulating because it's seeing it so often. So it's something where if you're having an occasional soda pop and you choose to have diet instead of regular, because then you're not taking the calories, that probably works great. If it's something where you're doing like 5 a day, like it may still be impacting weight. So So like always, it depends.
So is artificial sweeteners exactly the same thing as sugar?
Artificial sweeteners is not exactly the same as sugar. A lot of times the artificial sweetener is like, it's literally sweeter per gram than sugar is. And so like whatever it would take to sweeten it with sugar, you need more substance, and so it carries those calories with it. Because sugar, I mean, that's 4 calories per gram. So if you can use a smaller amount with an artificial sweetener, then you don't get those calories. But they still impact insulin production. If you do a little bit, it's probably fine. If you do a lot consistently over time, you're still impacting insulin. Still better than regular, but I don't know that it's as good as water. It's not as good as water. How about that?
So 2 a day is not gonna kill you, right?
So the question was, is 2 Diet Cokes a day going to kill you? No, it probably won't kill you. But if you notice, if you're like trying to make some weight loss or depending on what your weight goals are, that may be something to try cutting out for maybe a month and see if that helps. If it doesn't, you can always reintroduce it. So. What else?
Just maybe Dr. Coster says 2
I won't repeat that one for the online. Yeah.
My grandchildren like Lipton green tea or the peach tea. Is that okay?
Lipton tea for grandchildren.
Yeah.
So less than 12, no caffeine. Lipton tea is usually green tea, so it has some caffeine, up to 100 milligrams between 12 and 17 according to some sources. Other sources will be no caffeine at all. So if there's a caffeine-free tea option, that's fine.
They only drink like maybe 1.
Yeah, so it's probably below that threshold. I would
What
imagine.
about
Yeah.
for
And
an,
herbal teas, I mean, they don't have caffeine.
what about for an adult?
Sure. For an adult, so there's a whole bunch of studies. So the question was, what's the recommended caffeine intake for an adult? There's a lot of studies looking at different aspects of this, like what's healthy for heart health, what's for cancer prevention, what's for weight loss. So when I counsel people in my weight loss, I usually say kind of 200 to 300 milligrams and try to keep it, low in sugar. That's kind of my general rule of thumb. Any other questions?
So how much water did you drink a day?
Sure. So the question was, how much water do we drink a day? For adults, there's some data with 4 to 6 8-ounce glasses daily. For weight loss, we push it closer to like 85 ounces for females, and then for men, depending on physical activity, maybe closer to 100 ounces. What other questions? Yeah.
So if I drink a lot of coffee, does that mean that I'm dehydrating my body and I should get the same amount of water as coffee I drink?
Oh, sure. So the question is, can you do like the 1-to-1? Like you have a cup of coffee, you can have a cup of water, and it evens out. So I would say you want to drink more water than coffee. So maybe like 2 or 3 cups of coffee, and then closer to like maybe 6 to 8 glasses of water daily. So maybe 2-to-1. What else? Okay, well, you can always find me in clinic if you think of more questions, or let them know and they can let me know. So, and then, any questions on the chat? Oh, nope, doesn't look like it. Okay, well, thank you guys for coming today.